So first of all, Michael says that he's actually had rat soup before, and then he says he puts firi firi. For international viewers, that's pili pili. How Michael gets to that point, I do not know. But do you see? Anyway, ladies and gentlemen, let's just dive into that conversation. But before we do that, have you or a family member or a friend ever been bitten by a dog? And what should you do in case a dog bites you? Well, before we dive into that conversation, here are some of your thoughts on dog bites and rabies.
You know, it was 39. Do you know 39? 39 is a easy mwenda wazimu. Zikubite kama hospitali iko mbali and then you are done.
So you didn't give any first aid?
Nilijaribu tunaweza, nilitry kuvuta hiyo blood kwenye alikuwa maumwa. But kama ilikuwa isha move faster. Tukatry pia ku tie off, but pia ilikuwa isha move faster.
First, someone attended to me and given me the first aid. Some spirit was wrapped on my right leg, and then they covered me with a piece of cloth. Then after that, I proceeded to the hospital.
Okay, first of all, after he was bite with a dog, I took fresh water and washed the scar. After that, I checked out the nearest hospital and we went. She was given anti-rabies, and it is that vaccination that is being given in any hospital for the dog bite. So after that, he was well up to today. He doesn't have any infection. I think I was aware enough of what is supposed to be done.
I've heard stories. I have not seen somebody who's been bitten by a dog physically, but I've heard stories, and I know it's not a good situation.
All right, as you as our viewer at home, we'd really love to hear from you. Have you ever been bitten by a dog, or have you treated someone who has gone through it? Tweet us at KTN News, at Zinzi_K, at Michael G. Gitonga. My panel this morning is very closer to me. I have Dr. Caroline Nasimiyu. She is an epidemiologist, zoonotic disease unit under the Ministry of Health. On my far end, I have Dr. Victor Yamo, a farming campaigns manager, as well as World Animal Protection veterinary doctor with over 20 years in experience. It's so good to have both of you. All right, let me begin with you, Dr. Yamo. Perhaps maybe you can describe to us what a dog bite is, because perhaps it's not when your puppy sort of bites your hand and then you consider that a dog bite. I'm sure that wouldn't be a dog bite, but what constitutes for a dog bite?
Thank you, Zinzi. From where I see it, a dog bite is any situation where the dog actually bites you. Literally, and it could be as small as a puppy, or it can be a big dog. And the reasons why that could happen, especially when we are looking at situations where we interact with dogs. The important thing to understand is that dogs will not just bite you. Yeah? Dogs will bite you because either you've provoked it, or you've not looked after its needs, or there's something that it's drawing your attention to. So the critical thing is to understand that it doesn't matter what size of dog, it doesn't matter what age of dog, but anytime you're bitten, it's critical to take appropriate
So even
action.
though perhaps I'm playing with my puppy at home, as small as he or she is, and she's here tearing, is that considered a dog bite?
I would still consider it a dog bite, especially if your puppy has not been vaccinated.
Right.
It could be that the puppy traveled outside or went outside and picked something. And that's why we say dog bites are important to be reported, irrespective of how it happens and when it happens. Because it could lead to, the sequel could be somebody getting an infection out of it. Of course, the big one that everybody talks about is rabies. And we've seen situations where what looked like an innocent puppy and an innocent bite leading to serious conditions.
Right. Dr. Nasimiyu, perhaps you can tell us, how do we treat a dog bite? For example, if within the neighborhood there's a strange dog, all right, within CBD area, there's that dog that has gone astray, or even in the villages, right? How do you treat a dog bite?
First of all, I'd like to say that not only a dog bite transmits rabies.
Oh, okay.
A scratch can transmit rabies. A lick from an infected animal can transmit rabies.
Right.
So from the views of Kenyans, I've seen most of them have an idea of what to do when a dog bites. The first thing to do is to wash the wound.
wash the site of the bite with copious amounts of water and some soap.
Cold or hot water?
It doesn't matter, just water with a detergent or soap for at least 15 minutes, running water. Then seek medical attention immediately. So at the hospital, what they do is, of course, the wound should be left open, not covered. It shouldn't be, sutured, that is stitched. They will apply some iodine solution on the wound. So basically, that is number one, wound management. At the hospital, they'll also give you the vaccine, the anti-rabies vaccine.
Which you take?
It's injection. It's given intramuscularly, and it's several doses. So on the day of reporting, you'll get a dose, then you'll be given a schedule to come after 3 days, 7 days, 14, 28. So currently, we are doing 5 doses.
And when also you're out of the woods after 5 doses?
Yes, but the animal that bit you, the dog, let's assume in this case it's a dog, ideally should be confined. So once you're bitten by a dog, this should be reported to maybe your nearest veterinary officer so that they confine the dog. So they will be monitoring the dog.
And ideally, if it's a street dog?
Now that makes it hard.
Yeah.
So then you have to just do your 5 doses. But if it's a dog that can be confined and monitored, usually rabies will kill the dog within 7 days. So if a dog dies within 7 days, then this person needs to continue, until the 5 doses. But if the dog is still well, up to 10 days, okay, you confine it for 10 days and monitor. After 10 days, if it's still fine, then of course it's not rabies, because rabies in dogs is fatal, 100%. So then you'll be given the vaccine. So if the dog is fine after the 10 days, you'd have received ideally your day 0, your day 3, and your day 7 doses. So you have 2 more doses remaining. But if the dog is fine, then it wasn't rabid, so then you stop.
So it's not a do or die situation, in the sense that if God forbid, a dog was to beat me right now, it's not like within this moment that I would collapse and die. If we manage the wound, like you said, I have time to rush to the hospital, get it well done. You can survive a dog bite. It's almost so rabies.
You can't survive a dog bite. Again, dog bite is not equal to rabies. Okay? Not all dogs that bite have rabies. Okay? But we say that you do not know why the dog is biting, as Dr. said. You do not know the health status of the dog. You do not know the vaccination status of the dog. So you need to seek medical treatment immediately. Okay? Because again, if it was rabies, there's a window of opportunity. That you need to actually have that anti-rabies vaccine, outside which really there's not much that can be done. Of course, if you get rabies and the clinical signs manifest, then there's not much that can be done for you after that.
All right, so Dr. Yamo, how often does your dog or your pet supposed to get the shot, or is it a one-time thing?
Ideally, for rabies vaccinations, you should have the dog vaccinated once every year. Yeah, and there's an annual vaccination that needs to be done. And subsequent to that, I think the important thing is to look at the whole system holistically. Because, as Dr. said, Caroline said, not all dog bites are going to be equated to rabies, but there are other things that dogs can transmit to humanity. For instance,
e.g.
Dogs can transmit worms to human populations. Yeah. And so it's not just, I think what we need to be looking at is how do we look at the whole ecosystem around dogs and manage that so that the dog is looked at. The reason why then it bites is because its welfare is not catered for. And in terms of its welfare, it's looking at things like, do we provide for it food and water when it requires? The reason the dog would run outside to go and fend for itself is because at home, you're not meeting its nutritional requirements. And that kind of dog is most likely going to pick something that, like rabies, that will come back home with. So it will still be the same dog you've had, you'll still be playing with it, but you don't know the potential it's having around.
And Dr. Yamo, are there specific dog breeds that transmit rabies, or it's all dogs?
It's all dogs. Rabies is a disease for canines. So all dogs who transmit it. It's also in the wild systems, wolves, etc. Even cats at a certain level, but the predominant thing is a dog. And any dog, if not vaccinated and handled properly, is potentially going to, if it picks the virus, is going to transmit the disease. So part of what we then look at is how do we manage that system to ensure that the dog doesn't get exposed, and that's what we're looking at, its welfare Are you providing for it a comfortable environment, a home? And you see some of the things people do actually lead to situations where dogs react and bite. For instance, the natural African feeling is that dogs need to be chained so that inakuwa umbwa mkali. But that is actually negating one of its freedoms, what we call freedoms, because the animal should have a comfortable environment, a good house. It should not be chased. Dogs are actually supposed to exercise, which means it should have space to run. And if that is not catered for, the dog then becomes aggressive. And that dog is most likely going to bite you. And you've seen situations where dogs have even mauled children in this country.
And exactly, which is so sad. And do you also find sometimes that can dogs transmit rabies to each other?
Yes, they can. Any animal that a dog would bite, not only humans. If it's another dog, that's how rabies is actually transmitted within populations.
Donkeys, cows.
If it bites a donkey, if it does a cow, that animal will end up with rabies.
And then if it bites a donkey or a cow, in this case, that means their meat becomes infected. And if the cow collapses tomorrow, the last thing you have to do is then cut up that meat and eat it.
Actually, as Dr. said, it might not be necessarily that it would be transmitted by eating the meat, but the fact that that animal has saliva. A cow that has been bitten with rabies, for instance, will also bite. And that cow will still be able to transmit rabies by biting other animals or human beings that it gets in contact to. But the critical thing that we must understand, the dog is the one we need to manage, because that's where it's the main transmitter of rabies.
All right. So, Dr. Nasimiyu, how do we do that? What's the right way to manage a dog? Most so, especially if the dog is your pet. And I want to believe the best time to get such a dog is when they're still puppies, so you can train them. So what's the best way to manage a dog that is a pet?
I think there's a whole concept of responsible pet ownership that comes with most of the things Dr. Yamo has said. Shelter the dog. You know, dogs are our friends, right? Shelter the dog, feed the dog. The issue of letting dogs scavenge for food outside is a danger. So you find there are stray dogs. Usually these stray dogs have owners somewhere. You know, they're not ownerless. Vaccinate your dogs. Deworm your dogs. You know, play with your dogs. Take care of your dog like, you know, it's, in some countries really a dog is like a member of the family, you know. They take care of it. So take care of the dog like that. So
it's full-on responsibility.
It is your responsibility. And it's actually a legal requirement, if I'm not wrong. There's a Rabies Act, which requires the dog owner to actually vaccinate the dog annually. And to take care of the dog.
And there's something that Dr. Yamo said that caught my attention. In the African culture, for us, how we treat dogs is that we tend to tie up in chains. And then, you know, with the Umbwakali logo outside your gate, right? But then my question then would be, Dr. Nasimiyu, when you have such a scenario, especially dogs that are meant for security, dogs that are naturally by nature aggressive, that are meant, again, for security purposes, it's the same thing, though. You still take them for the injections, you still show them love, you still show them, you still feed them the right way?
In our community, dogs are kept for different purposes. You know, pets, not so much in our setup, but security is one of them. In some communities in Nyanza, you'd find them being kept for hunting, you know, sometimes to help in fishing and such kind of things. The care is basically the same. Of course, the feeding could change, you know, the type of feeding. Like you, if you're just an office worker versus someone who is maybe a boxer, you know, your diet will change, but the basic level of care remains the same.
All right, okay, all right, no problem. Before we can dive into animal rights, because that's also still encompassed within our conversation, which, by the way, tomorrow is October 4th, World Animal Day. Right now, current practices for wastewater treatment in Africa are insufficient to ensure safe water and basic sanitation for millions living in poverty. But a project in Kibera, known one of the world's largest slums in Nairobi, is trying to change that reality. See how.
Ever since 2016, when Nelly Misango moved to Kibera, Africa's largest urban slum, her kids often fell ill. The culprit was contaminated water.
Ya hapa hawajakuwa infection hakuna juu maji hapa imehifadhiwa vizuri.
This water had a lot of effect on us. They would complain of stomach aches, but when I changed the water to the treated one, I saw a lot of difference.
Misango found clean water provided by the Human Needs Project, a non-profit that builds in poor areas of the world. Known as Kibera Town Center, the project recycles dirty water while providing bathroom and laundry facilities and clean drinking water for 2,000 residents per day.
We came up with the recycling system basically to serve one as a pilot to be able to basically show that it can be done here. And I believe if anything can be done in Kibera, then it can be replicated to any part of the world. And our system basically was designed to counter poor waste disposal systems of sewer, water from sewer lines and things like that. So that was the first intention. The second intention was incorporation of technology to be able to uplift the livelihood of Kiberans.
The United Nations says Africa's fast-growing population and urbanization is making wastewater treatment a growing challenge in informal settlements like Kibera.
From the morning, from the time we wake up till we go to the bed. And not treating wastewater leads to very damaged health, both for us, ourselves, and for the environment. When you look at wastewater, there are so many things in this, what we name wastewater. You have pathogen in that. You can have heavy metals. You can have pharmaceutical. You can have some chemical, which is very harmful. So if it's not treated and it gets in contact of our food or our bathing or our drinking, then it's really impact on our health. It's also impact our fish, our fauna, our flora, so it's why it's really important, particularly in the settlement where the planning is sometimes not well done.
Expanding clean water projects like Kibera Town Center to the large slum population estimated at over 500,000 requires massive investment. Right now, the money isn't there, even as urban populations grow bigger each year across the continent.
All right. There's something that you also mentioned about the fact that there is a law when it comes to vaccinating your dogs. It's an actual requirement under the animal rights. Does the same thing apply perhaps for other animals as well that are not dogs, like for maybe cat lovers, Dr. Yamo?
Yeah, well, the law that governs rabies is called the Rabies Control Act. Mm-hmm. And it requires and it makes it mandatory that the owner of the animal must ensure that it's vaccinated and must have a vaccination certificate. And in terms of vaccination, it must be done by a professional who is able to actually give you a vaccination certificate signed with the vet's name and their registration number. The law also goes further to say that in the event that dog bites somebody, you're actually culpable and liable for the cost of that treatment. So it's part of the process of ensuring that the animal is actually catered for. And counties have then gone further to develop county legislations like in Nairobi, where it's a requirement for the owner to have the dog vaccinated and have a certificate.
But then the question would be, how accessible are these services? If you ask a Kenyan on the streets, where is the first veteran? Who do you call? which mall do you go to that you'll find a veteran? That's the other thing, accessing such services.
Veterinary services is actually accessible in all counties because each county has a county veterinary services under the county director of veterinary services. They're then assisted by private practice, just like in human medicine, they have private veterinary clinics. And if you ask the Kenya Veterinary Board or the association, they would be able to give you. And they're as close. I know, like, for instance, in Nairobi, there's a vet clinic in Buruburu, there's a vet clinic in Timol. They're all over the place. If you inquired from the association or the profession, they would be able to show you. However, I also wanted to say that vaccination for animals is also catered for, the other animals. Of course, you asked a very critical question.
Yes.
The Animal Diseases Act requires that certain vaccinations are done either as counties or as mass vaccinations or as individual vaccinations. But I think the owners, if you want to connect it to what you're calling animal rights, which I prefer to call animal freedoms, because in animals we do not talk about rights, we talk about freedoms, and there are 5 freedoms. The first freedom is what we talked about earlier on, freedom from hunger and thirst, which is just to ensure that the animal is catered for. Its needs, some basic needs, food and water is catered for. The second freedom is freedom for a comfortable, from discomfort, which means the environment the animal is in. And if you look at dogs, we've talked about the space that you give it. It's not just about a kennel, but the kennel should be certain specifications, big enough for the dog to actually turn around. A lot of our kennels, the dog goes in and reverses out like a car.
So that looks at the environment.
Yeah, that's part of the environment. The third thing, which is what ties to what you're talking about, is freedom from pain, injury, and disease. It means that the animal must not be injured. It should not go through painful situations. If you look at donkeys, if you look at chickens being transported upside down, if you look at pigs being tied behind a motorbike going to the market, those are illegalities. And the last bit is free from disease, which means we must vaccinate them. We must ensure that our hygiene and sanitation is at the high level. We must ensure that if it's a production system, the biosecurity, meaning that you're protecting the chickens or the cows from getting diseased by contamination. Those kind of things become very critical.
Allow me to take a step back, Dr. Yamo, before we can talk about the animal rights, or in this case, animal freedom. The T9, tell me about the T9. It's a specific breed?
I have to say that a T9 was just a dog that, you know, dogs, if they are mismanaged or mishandled, tend to go back to their wild selves.
And that's the thing, because you find certain dogs that even attack fellow dogs.
Exactly.
And in a very gruesome manner.
And that's what we are saying. It's because the dog's basic freedoms have not been met.
Right.
Yeah? And dogs, I think I need to use an analogy like what one of my friends talks about. Dogs are like children. Don't have excessive dogs. Yeah? And there are ways of managing that in terms of, and that's what I think she was talking about, there's responsible pet ownership and there's dog population management. In the old system, the Rabies Control Act said that if there's an outside of stray dogs, we quickly put strychnine and kill them. But what has been done, found by research, recent research, is that that doesn't solve the problem. Because what happens is you create a vacuum. Sooner or later, certain dogs, 3 to 6 months later, a new population of dogs come into that situation. So what you need to be looking at is holistically the environment. Why are the dogs getting stray? It's because we are mismanaging them. Why are they going to particular situations? And what we've seen in some situations is how we dispose our waste from institutions. If you're throwing waste outside in a heap somewhere, the dogs quickly learn that every time at about lunchtime, there'll be food that is left over and there'll be food there. That starts creating stray dogs. The interesting thing, when you talk about stray dogs in the African situation, there are no stray dogs. The moment we use the Rabies Control Act and say that, because before we bait, the legal requirement is we must warn you so that the owners of the dogs can keep their dogs. You put the bait, you find no dogs, because every dog then goes back to its rightful owner. And the following day, when you remove the bait, the dog population then comes in. So it's an attitude that we need to change and educate people to understand.
And speaking of stray dogs, or in this case, street animals, Dr. Nasimiyu, what laws are there that protect stray dogs?
If I could go back on the issue of vaccination, Kenya has a strategy to eliminate rabies by 2030 from the country. And one of our major pillars is actually mass dog vaccinations. So availability of the vaccine, if you compare dog vaccines and human vaccines, in terms of the cost, the human vaccine is 10 times the cost of the dog vaccine. So, you know, a dog vaccine, one dose would cost $1. On the human side, one dose would cost $10.
Wow.
So 1,000 to 1,200 versus 100.
100, right.
So really, the vet department should be trying its level best to avail the dog vaccine. Now, in terms of legislation, I cannot speak on the side of animals.
I will help you.
Yes.
Right, please, by all means, Dr. Yamo.
I want to do two things. I want to clarify about the vaccination costs.
Okay.
What Dr. Caroline is talking about is actually the cost of the vaccination. We must also alert people to understand that there's a delivery cost. There's the cost of vaccination, but there's the cost of transporting it, vaccinating, which then increases the cost slightly higher. But somebody has to meet that cost.
And back to the question of the laws that protect stray
I'm coming
animals.
to that one. But that's something that we need to talk about. Because if you leave it at the point that you say the vet department just needs $10, then we are not doing the right thing. It's beyond $10 because the department must get the vaccine from the manufacturer into the system, which is a cost, something that we need to cost. The debate would be, are county governments ready to take that cost, or is the owner of the dog ready to pay a veterinary surgeon to actually meet that cost? Now, going back to your legislation question, what controls the stray dogs is what we call the Protection to Animal Prevention of Cruelty to Animal Act, Cap 360, which says that no animal should undergo any cruel situations. And in that act, Section 3, I think Section 3 talks about what you need, the fundamental freedoms I was talking about, because the act has found out that, or the act's legislation confirms that dogs only become an issue if their basic needs are not met. And the same applies to any other animal. It's not only dogs. And so protecting the rights of that animal is actually governed under Cap 360, and it's actually part of what the Constitution talks about. So when we ratified the Constitution, we actually put animal freedoms into that Constitution.
All right. And so Dr. Nasimiyu, you mentioned the 2030 goal to eradicate rabies. How far are we as a nation with that?
It's a strategy to eliminate, not to eradicate, to eliminate rabies. It was launched in 2014, so it spans to 2030. That by then we'll have no human deaths from rabies. We know that 99% of all the human cases are actually caused by the domestic dog. So this strategy is a stepwise kind of approach, okay? So as it is, where we are with that strategy is that we are still piloting. So we have 5 pilot counties. We have Kisumu, Siaya, we have Machakos, Makueni, and Kitui. And actually, in those counties where we've started this strategy, you find that county governments have taken up the cost of the vaccine, and the human vaccine, is actually available for near free to all bite patients. So it's strategy in progress. We are looking to move out of the pilot counties soon, and hopefully with funding from counties, uptake by counties themselves, we will be able to eliminate rabies by 2030.
All right, so in the same conversation of animal freedom, Dr. Yamo, I want us to take a look at slaughtering, since it's a practice that we do here in Africa under the name Nyama Choma. Is there a right way to slaughter animals, be it the chickens, the cows, whatever it is that we will have as a dish for Nyama Choma? Is there a right way to honor and do it?
There is actually a right way. And again, Prevention of Cruelty Act talks about it. The Meat Control Act also talks about it.
So how do I kill my chicken without it going through cruelty?
In an ideal situation, animals must, if you're going to do the slaughter process properly, you must bring an animal to the slaughter place humanely. Our biggest challenge starts from how we transport animals. An animal transported like cuckoos upside down on a handlebar. He's already having stress. Yeah? That meat is not going to be good quality meat. That's number one.
Because the animal has stress.
Has stress. Even when you're stressed, you have adrenaline, your muscles, Dr. Ria could tell you, your muscle undergoes different things.
When you know you're about to be in trouble.
So that transport must be, and there are actually laws and regulations under the Prevention Cap 360 that talks about how you transport animals, whether it's a cow, properly, and the international laws to trade around that.
So Kenyans have the habit of where we put one under our armpit when we're walking around town and entering into a KBS, and I'm just from Ushago, I gotta get this chicken home.
That might look better than tying it upside down on the roof of a vehicle going
Imagine, and all that wind.
Yeah? But the other thing is, the thing about keeping chickens under your arm coming from Ushago is also a disease control issue. The epidemiologist here can tell you chickens also carry disease. So you're literally spreading disease if it's a diseased chicken around the situation. But let's go back to
back to the chain. So we have to transport them the right way.
So transport them rightly. When they get to where they're being slaughtered, you need to give them a period for them to rest and relax so that the muscle is not tight. Now I'm teaching you, these are the things we need to understand.
I'm sure Kenyans are thinking, like, this is not how we do Nyama Choma.
Yeah, I know. In the village where I come from and where she comes from, we run after chickens. That chicken ends up being very hard. Why is it hard? Because it has run, it has adrenaline, the muscle has undergone some other processes.
No problem. So the chicken rests?
Yeah, rests. Then before you, of course, when it rests, part of the requirement for a good meat inspector is to then do what is called ante-mortem examination. You must ensure that the animal is healthy, it is fit for human consumption. It's not just after you slaughter that you look for that. There are diseases you can pick that go into human populations when it, at that phase, when it's resting. Part of allowing it to rest is if it had a disease condition, it could show. And then you knock it out of your food chain, because anything that you put on your on that food plate chain will end up in your plate.
Oh no!
Yeah. Then you stun it, and the idea of stunning an animal is to make the death as humane as possible.
So how do I kill my chicken in the most inhumane possible?
I will get back to that, because I'm still talking. I'm coming from the big commercial side. Then we'll talk about what you need to do.
I'm so anxious to get to that point, but continue, Dr. Yamo.
Okay. Then once you stun it, the stunning just literally gets the chicken to a comatose stage, when at that point you can slit the throat. That allows, the heart is still beating, allows it to drain all the blood so that you don't have blood remaining in the carcass, because blood remaining in the carcass becomes foci for bacterial contamination, which leads to food spoilage. Then after that, you can do the rest of the process.
That's such a process, Dr. Yamo.
Yeah, but now for the villager, because I know when I say this, I'm reminded that I worked for a big commercial setup. Now what does a villager do? In village systems, the idea is, how sharp is your knife? Your knife should be sharp enough that when you cut off the head of the chicken,
it's maramoja.
It's maramoja, because then the chicken doesn't go through that process. But when you're struggling with the knife, you're actually causing more pain. Remember fundamental number 3, freedom from pain, injury, and disease.
Right.
The chicken then flaps, the muscles then go into actions, the animal ends up being injured. And one of the recent studies that we did working with the big farmers, we discovered that a good chunk of our farmers are losing money because of simple things. The transportation is wrong, the animal ends up with broken wings, it gets to the processing plant, that has to be condemned or downgraded. The farmer doesn't make money.
But Dr. Yamo, here's the thing. Are our bodies, our meat bodies, leave alone the farmer, are our meat bodies also going through these regulations?
A good processing plant in this country, the big processing plants, actually, let me say, all processing plants have veterinary officers or meat inspectors who should manage that process. So if your animals is being slaughtered in a good, officially recognized meat slaughter slab or meat slaughter process, then that is being managed. The challenge, I think, is when we are doing our own backyard slaughter, where we are just using any sort of knife and we're not looking at it critically. So that's the important thing that we need to be looking at.
Someone might argue, let's say if I have a farm back in my backyard and I rear chicken, right? And every morning they wake up, there's music playing, sunshine is there, they get the best food, and they lay their eggs. I can slaughter it. Is it okay for me to slaughter it the following day and eat it?
It's just a question of how you slaughter it.
It has spent a beautiful life.
It has spent a beautiful life, but at the end of this beautiful life, are you doing the slaughter process properly? Or are you then negating what you've done well? And that's what I was talking about, the research we've done recently with the University of Nairobi as well as Animal Protection. It shows that farmers are doing a relatively good job until the point at which we are picking the chickens and taking them to the slaughterhouse. That's where the farmer then loses.
Let's have our closing comments. And I'll start with Dr. Nasimiyu, who has been laughing the whole time. I'm sure she's representing quite a number of Kenyans, including myself, having to learn about this process of slaughtering. Perhaps your closing comments.
My closing comments would be, rabies is preventable. It's preventable. Honestly, all measures should be put in place to prevent the disease, because once you're infected, really your fate is sealed. So it's preventable. So basically, from the ministry's point of view, we are asking the public to be aware of that fact and to report all cases of dog bites to health facilities, because then they can be helped. And again, as I said, there's that window of opportunity outside which nothing can be done.
All right. Dr. Yamo, your closing remarks?
My closing remark will go down the road of animal welfare. Animal welfare is important, and it's important, one, for the animal, because we must remember that animals are sentient. And sentient is just to say animals can remember, they can experience, and they have feelings. The second thing why animal welfare is important for you and I want to just put it plainly like this. Animal welfare is important for food security, because animals that have been managed well in the production system end up having better production and giving you a better quality product with less
I'll remember that with my chickens. I shall remember.
Better production, and these are things, science. What I'm saying is scientifically proven.
Okay.
Better production, better quality products. Research done in this country confirms that. But the third thing, animal welfare is also important for you and I, because it's around international practice.
And that's a fantastic note to leave out on, Dr. Nasimiyu and Dr. Yamo. God bless you so much. Thank you for coming in studio and helping Kenyans really understand this whole situation.
Thank you for hosting us.